What is a corneal abrasion? A corneal abrasion is a simple scratch on the clear part of the eye.
The cornea is the transparent layer that covers the colored portion of the eye, the iris, and the pupil, and allows the light to enter.
Most corneal abrasions will heal immediately in a few days and it will pass. However, for patients, a corneal abrasion may be very painful. I have heard it described as sandpaper, as sand in your eyes. How does a corneal abrasion occur? Under general anesthesia, you have decreased tear production. Ocular reflex, which protects you when an object comes close to your eye, it is gone with general anesthesia. So it is for us, the anesthesiologists and the medical practitioners, to protect the patient's eyes. Patients themselves may inadvertently cause corneal abrasion, particularly when they wake up and they're moving. Before they have fully come to, they could scratch their eye with their finger, with their nails, sometimes with a pulse oximeter that is put on the tip of the finger, which is why we don't want to put it on the index finger because the patient is most likely to use the index finger to rub the eyes. Also be inadvertently scratched by a medical practitioner's badge, a stethoscope, wires and tubes. That is why we tape the eyes during the anesthetic and we remove it right before the patient is due to wake up. And then for a period thereafter, we have to continue protecting the eye until they come fully to. A corneal abrasion can occur by a poke, by someone throwing sand in your eyes. Think of children playing in the sandbox outside, being caught in a sandstorm, wearing ill-fitting or dirty contact lenses, rubbing your eyes too much excessively. Your own nails can cause an abrasion in the cornea, walking into something like a branch, getting chemicals in your eye, getting sawdust, which is why when you're working with wood, we need you to put on goggles. When you're working with blood, when you're working with bone, for instance, you're doing an orthopedic procedure, you can get a corneal abrasion during sports, engaging in high-risk activity without wearing eye protection.